Interoperability: The Who, What, and Why Not by Lucas Warner. Interoperability refers to different health information systems being able to communicate patient information across one another's platforms. This enables a greater outcome for patients as more information is provided to their providers. That is why there is currently a push in the healthcare field to promote interoperability among health information systems. There are, however, some barriers to the adoption of interoperability. The Healthcare Information and Management Systems Society, or HIMSS for short, is a nonprofit group that leads efforts to improve interoperability within the healthcare field. The HIMSS has developed 4 layers of effective interoperability amongst healthcare information systems. The most basic layer of interoperability that the HIMSS lays out is foundational interoperability. This is achieved simply by a system's ability to send and receive signals, but not necessarily for the receiving institution to be able to interpret that data effectively. The next tier of interoperability is structural interoperability. This level defines the syntax of the communication. In layman's terms, it allows for signals to be sent and received, but also for the receiving system to interpret that message in its original format. Semantic interoperability was formerly thought to be the highest level of interoperability that was defined by the HIMSS. This level of interoperability means that a system can communicate and be interpreted by multiple systems. This is because of its usage of common language and format styles. There is recently, however, been a designation for a higher level of interoperability. The newly designated organizational interoperability level is now considered the highest tier of interoperability. This level goes further than simply the technical considerations when using health information systems, but also takes into account policies, procedures, and the social components of the receiving institutions. Adopting new policies, procedures, or new technologies comes with a burden on the institutions that are adopting these. The Department of Health and Human Services has identified 6 barriers that keep health institutions from adopting common interoperability standards. The 6 common barriers that the department has identified are technical barriers, financial barriers, trust barriers, administrative requirements, reporting requirements, and IT usability. Interoperability will allow for a greater amount of knowledge about each patient to be shared amongst providers. This will make the provider's job easier by being able to access more pertinent information about the patients that they are seeking to serve. This, in turn, will create enhanced outcomes for the patients that are receiving treatment from these providers and institutions. I hope you have learned something about the importance of interoperability and how it can benefit the healthcare field. Thank you.